Hey everyone. So today we're going to break down Chapter 8, Hair and Scalp Disorders and Diseases. So if you are currently in cosmetology school or taking cosmetology courses, or if you just simply want to refresh yourself over the topic or learn something new, this is a great video for you. There are 4 objectives to this chapter. Objective number 1, explain the importance of understanding hair and scalp disorders and diseases. Number 2, explain the cause of most common types of hair loss. Number 3, identify most common hair disorders. And number 4, identify the most common scalp disorders. As a cosmetologist, you want to be able to recognize what is treatable by a cosmetologist and what to refer to a healthcare provider. Identifying the differences between common and irregular hair loss helps to better recommend client hair loss treatments, and also recognizing communicable scalp and hair conditions as well as when a client should be turned away and referred to a physician is part of your infection control duties. So let's delve into objective number 2, common types of hair loss. So let's start with what hair loss is. So as a cosmetologist, you will often be the first resource for clients to help them distinguish between common and irregular hair loss. It is common to lose 50 to 100 hairs per day. However, there are some conditions that can cause irregular or even significant hair loss. The technical term for hair loss is alopecia, and that means that the partial or complete loss of hair from where it typically grows is called alopecia. The most common types of alopecia are androgenetic alopecia, alopecia areata, and postpartum alopecia. Let's discuss androgenic alopecia. So androgenic alopecia is also known as androgenetic alopecia, and it's characterized by terminal hair miniaturization and a shortened anagen phase. It can affect anyone and is caused by genetics, age, or hormonal changes. Androgenic alopecia is common with approximately 50% of people experiencing some degree of hair loss after puberty and as early as their teenage years. Approximately 30 million women in particular experience hair loss, commonly after menopause. Male pattern hair loss generally involves thinning and or baldness in a horseshoe shape, while female pattern hair loss typically appears as a generalized, diffused thinning over the crown, top of the head, and temple areas. Alopecia areata is also another type of hair loss. This one is an autoimmune disorder, and what happens is the immune system attacks the hair follicles, which leads to hair loss in a round or irregularly shaped patches. So what happens with alopecia areata is that white blood cells stop hair growth during the anagen phase, which is the growing phase of hair, which causes the hair to enter the telogen phase. The scalp appears normal in areas of hair loss, but again, alopecia areata is an autoimmune disorder. There are also advanced forms of alopecia areata, which includes alopecia totalis, which means that there is a loss of terminal scalp hair. And then we have alopecia universalis, which means that there is a loss of terminal hair on the body and the scalp. Postpartum alopecia occurs in people or in women after pregnancy. This particular hair loss usually shows up between 1 to 5 months after delivery, and a higher number of hairs enter the telogen stage, which is what causes this hair loss. And if a woman is suffering from postpartum alopecia, it typically regulates itself within 6 to 12 months. There are only 2 FDA-approved treatments for hair loss, and they are minoxidil and finasteride. Minoxidil is a topical medication applied to the scalp, and it has been proven to stimulate hair growth and comes in two different strengths: 2%, which is your regular strength, and 5%, which is your extra strength solution. Rogaine is the most well-known minoxidil product. Finasteride is an oral prescription medication. It's more effective and also convenient to take than minoxidil. However, it may have negative side effects, including birth defects in a male fetus, and therefore it is not prescribed for people with childbearing potential. So women would not be the best candidate to take finasteride. There are also other surgical options for hair loss. Hair transplants, which is the most common permanent hair replacement technique. This process consists of removing hair follicles from one or more areas of the head and transplanting them into the desired area. Not many people talk about the emotional impact of hair loss, but we do want to cover that you as a cosmetologist are going to be the person that's going to help your client find solutions. About 80 million people in the U.S. experience hereditary hair loss. With multiple studies linking hair loss to lower self-esteem and lower confidence, you need to be aware that this is a sensitive topic that clients may be hesitant to talk about. You are in a unique position to help your clients develop a plan to address their thinning hair. Having a strong understanding of hair loss types, current products and treatments available, and what falls within a cosmetologist's scope of practice in your state will help you serve as a resource for clients. Objective number 3, hair disorders. So we're going to identify the most common hair disorders in this segment. The first disorder that we're going to discuss is conichiasis. So conichiasis is nothing but gray hair or white hair. Conichiasis results from a loss of the hair's natural pigment. There are two types of conichiasis. We have congenital conichiasis and acquired conichiasis. Congenital conichiasis is present at birth. So an example of congenital conichiasis would be albinism. People with this condition are referred to as albino and are born without pigment in their skin, hair, and eyes. Acquired conichiasis is a result of age and genetics. As we age, the hair follicle produces less melanin, which causes gray or white hair. Extreme stress or illness can also contribute to graying hair. Ringed hair is the next type of hair disorder. It is characterized as a variety of conichiasis by alternating bands of gray and pigmented hair throughout the length of one individual hair strand, or out throughout the length of all of your hair strands. So it would be alternating spots of gray hair and pigmented hair on all of the various hair strands on your scalp. Hirsutism is the growth of terminal hair on a woman's body in areas that typically do not have terminal hair, such as upper lip or the mustache area, chin and cheeks, which would be the beard area, and the chest. So hirsutism is basically abnormal hair growth on a woman's body in places women typically do not grow hair. Then we have hypertrichosis. Hypertrichosis is a condition in which hair grows longer or thicker than usual. Treatment for hypertrichosis include electrolysis, laser hair removal, shaving, tweezing, depilatories, epilators, threading, waxing, and sugaring. Trichoptilosis is the technical term for split ends. Hair conditioning treatments soften dry ends, but there is no way to repair them. The only way to remove split ends is by cutting them. Split ends that are not removed will continue to split up the hair strand. So consistent or frequent hair trims, especially for your clients that have split ends, is going to be beneficial for them. The next hair disorder is trichorexis nodosa. It's a technical term for knotted hair. It's characterized by brittleness and the formation of nodular swellings along the hair shaft. When in this state, hair breaks easily and the broken fibers spread out like a brush along the shaft. Trichorexis nodosa near the scalp is often caused by chemical straighteners or excessive thermal pressing. Damage located towards the hair strand's ends is caused by mechanical damage such as excessive back combing or brushing and hair aging. Treatments include softening the hair with conditioners and moisturizers. Our next hair disorder is called monolithics. It is a technical term for beaded hair, beaded like beads. So monolithics is the technical term for beaded hair. The hair has a beaded appearance due to the narrowing of the hair shaft, and the hair is brittle and breaks easily. People with monolithics also have sparse hair growth. Monolithics is caused by a gene mutation and has no recognized treatment. People with monolithics should avoid hair trauma such as hair coloring, bleaching, and perming. Conditioning the hair and scalp will help achieve maximum growth potential. And lastly, we have fragilitas cranium, which is a technical term for brittle hair. What happens here is the hair may split or break at any part of the strand, causing excessive exposure, causes of brittle hair or causes of fragilitas cranium is due to possibly excessive UV exposure, mechanical or chemical abuse, and pulling the hair tightly into braids or ponytails. And then treatments for this condition include conditioning the hair and cutting above the split to prevent further damage. Objective number 4, scalp disorders. Since the scalp is skin, I want you to know that skin is always in a constant state of renewal. The outer layer covering the body is shed continuously and replaced by new cells. The skin cells of healthy scalp fall off naturally as small dry flakes without even being noticed. So let's talk about dandruff. Dandruff can easily be mistaken for dry scalp because the symptoms of both conditions are flaky, itchy scalp. But there are differences. Dandruff commonly produces an oily scalp. The flakes from a dry scalp are much smaller and less noticeable than larger flakes seen with dandruff. Dry scalp can result from contact dermatitis, sunburn, or advanced age and is usually made worse by cold or dry climate. The technical term for dandruff is called pityriasis. Please make sure that you understand and have this in your notes. So, pityriasis is characterized by the excessive production and shedding of skin cells. Dandruff is caused by a naturally occurring fungus called malassezia. Malassezia feeds on the scalp's oil. When the scalp becomes irritated, redness, itching, and dryness can be present. Dandruff can be affected by stress, pollution, and seasonal changes. Anti-dandruff shampoos contain antifungal agents such as pyrithione zinc, selenium sulfide, or ketoconazole to control dandruff by suppressing the growth of malassezia. Anti-dandruff shampoos are available in a variety of formulas for all hair types, and they also can be gentle enough for everyday use. Regular use of an anti-dandruff shampoo is essential for controlling dandruff. And I do have another note that dandruff is not contagious. Now, there are 2 types of dandruff. We have pityriasis capitis simplex, and then we have pityriasis steatoides. For pityriasis capitis simplex, it is a technical term for classic dandruff characterized by scalp irritation, large flakes, and an itchy scalp. The scales may attach to the scalp in masses, scatter loosely in the hair, or fall on the shoulders. Regular use of anti-dandruff shampoos, conditioners, and topical lotions is the best treatment for this type of dandruff. Then we have pityriasis steatoides. This particular type, pityriasis steatoides, is the most severe case of dandruff, characterized by an accumulation of greasy or waxy scales mixed with sebum that stick to the scalp in crusts. Infants with this condition are referred to as having cradle cap. When this condition is accompanied by redness and inflammation, it is called seborrheic dermatitis. Seborrheic dermatitis can also be found in the eyebrows or beard. When trying to determine if your client has dandruff that you should not treat, look at the color of the skin and the flakes in the affected area. Seborrheic dermatitis will resemble a rash. Do not perform services on anyone who has this form of dandruff. Anti-dandruff shampoos can be recommended to a client with mild conditions, but anyone with a severe condition should be referred to a healthcare professional. Fungal infections. All right, so I want you to know that anytime that you see the word tinea, that means fungus. And so we're going to break down different fungal infections that may be present or that you may see in the salon. So let's start with tinea, because tinea is fungus, okay? So tinea is a technical term for ringworm. Symptoms of tinea include itching, scales, and sometimes painful circular lesions. Tinea is caused by a fungal organism and not a parasite. Tinea infections are named for the body part or location they infect. All forms of tinea are contagious and can be easily transmitted from one person to another. Infected skin and hair, as well as unclean bathtubs, swimming pools, and personal articles are transmission sources. Practicing proper cleaning and disinfection procedures will help prevent the spread of these infections. So let's break down the first one that we see. Tinea capitis or tinea capitis, however you want to say that. It is a fungal scalp infection known as ringworm of the scalp. The term ringworm is used due to the circular shape of the lesion. It is characterized by red spots at the opening of the hair follicle. The hair becomes brittle and it breaks. There may be black spots in the patches where the hair has broken off. Okay, so that is tinea capitis. Then we have tinea barbae. Tinea barbae is caused by the dermatophyte fungus. It primarily affects the beard and mustache areas of the face. It is similar to tinea capitis in appearance, and the skin may be very inflamed. Do not perform services on anyone with suspected tinea barbae. Refer the client to the healthcare professional instead. And lastly, we have tinea favosa, which is also known as tinea favis or honeycomb ringworm. It's characterized by a dry yellow crust on the scalp called scutula. Scutula has a distinctive odor, and scars may result from tinea favosa. Hair will not grow back in scarred areas, so this one is definitely more severe. Do not perform services if you suspect your client has any of these fungal conditions, and always refer them to a healthcare provider for treatment. Parasitic infections. So I want you to know that parasites always have to have a host. The first parasitic infection that we're going to discuss on this slide is scabies. So scabies is a highly contagious condition caused by mites called Sarcoptes scabii that lay eggs inside the skin. Scabies symptoms include intense itching and a rash that may have blisters and bumps that resemble acne. Scabies is spread from skin-to-skin contact. The mites cannot live longer than 24 to 48 hours without a host. Next, we have pediculosis capitis. We call pediculosis capitis lice on the low end. So pediculosis capitis is an infestation of the hair and scalp with head lice. Head lice are parasites that feed on human blood. Head lice are transmitted primarily from head-to-head contact with an infected person. They may also be spread by contact with infested hats, combs, brushes. Head lice can only live 24 to 48 hours without a host. Distinguish head lice from dandruff flakes by looking closely at the scalp with a magnifying glass. With head lice, you'll see small nits or eggs attached to the hair. An adult louse is about the size of a sesame seed. Lice are more difficult to see on individuals with dark hair. They move by crawling and cannot jump or fly. Never perform a service on someone with head lice. Over-the-counter treatments are available. The directions must be followed to effectively kill the lice and the eggs. Next, we have bacterial infections that you may come across or observe in the salon. So, bacterial infections of the scalp may be caused by either streptococcus or staphylococcus bacteria. The most common types of staphylococcus infections are furuncles, carbuncles, and folliculitis. Let's break them down. A furuncle is a technical term for a boil. It is an infection of the tissue surrounding the hair follicle. Do not proceed with services if there is a boil in the area until it has completely healed. In the middle, we have what we call a carbuncle, which is still a boil, but they are boils that form in a cluster. They are caused by staphylococcus and extended to the subcutaneous tissue. Again, do not provide services until the affected area is completely healed. And lastly, we have folliculitis. Folliculitis is inflammation or infection of the hair follicle. Please make sure you make note of that. It presents as small red bumps or whitehead pimples around one or more follicles. Mild folliculitis may heal itself in just a few days, but more severe cases may need medical attention. Folliculitis barbae, which is also known as pseudofolliculitis barbae, is a common type of folliculitis. And what happens with that one is there is an inflammation of the hair follicles caused by ingrown hairs and can occur anywhere that hair has been shaved or tweezed. Do not perform hair services on anyone with active folliculitis or folliculitis barbae. Properly practicing state board approved cleaning and disinfection procedures will help prevent the spread of these infections in the salon. That is all of the hair and scalp disorders for chapter number 8. Our 4 learning objectives that we covered were to explain the importance of understanding the hair and scalp disorders and diseases, explain the causes of the most common types of hair loss, identify the most common hair disorders, and also to identify the most common scalp disorders. My recommendation for you is to open up your textbook or your ebook to 162 and 163 and work on your vocabulary to make sure that you understand and know all of the different terms that are associated with chapter number 8. We hope that this helps, and if you have questions, feel free to leave us a comment under our video and we will be sure to help you as soon as we can. Have a great day, and we hope that you have learned something more or on a deeper level with hair and scalp disorders and diseases.